Hello, welcome to INOVIUM Neuro, a neurology clinic located in the very heart of Belgrade, right behind the Serbian Parliament building. I have a great honor to talk today to its founder and owner and one of the greatest specialists in clinical neurology, clinical neurophysiology, Professor Dr. Tihomir Ilic. Your name is famous within doctors and academic circles, but I would like you, if you can introduce yourself and your practice to the wider audience.
Thanks for your question. I'm working in a field of medicine for more than 30 years. So the most of my previous professional work was just related to my homeland, the Serbia. But beside that, I spent several years working with the patients and doing research, mostly in Germany. So collaborating with the people from whom I can learn a lot. So this kind of my professional experience beside the clinical neurology is very much focused on this technique which just stands above your head. And it's called transcranial magnetic stimulation. Actually, it is the technique that through the magnetic coil we delivered very high intensity magnetic pulses. When it applied in a trance, we can change the function of specific brain regions. So for first time when I started to do that, and that's more than 25 years nowadays, so it's mostly was a research technique. So we are doing that quite a lot, just trying to understand better the physiology of human cortex. So it was a very extended and actually very fruitful period of my life, my professional life, when I was working at Goethe University in Frankfurt am Main in Germany. And we did a couple of very basic and fundamental discoveries through research regarding to communication between neuronal cells in a very superficial layer of cortex. After that, several years after, it comes the new kind of application. Actually, some of American psychiatrists in the first row, they found our discoveries as the good fundament for further application of technique for treatment. And as the first indication and as the most prominent one even nowadays is the treatment of so-called pharmacoresistant depression. Pharmacoresistant depression means that it's a specific type of organic depression that doesn't respond well on pharmaceutical agents, I mean on drugs. So this technique is very widely used in Western world, at first place in US, where it's established more than 70 TMS clinics.
So this clinic is the first one in the region, even in the Europe, first one performing.
Yes, for sure.
TMS.
Yes, for sure. Actually, I'm the first one who are doing that in this region, starting from 1997. And in the meantime, therapeutic application, it was started here. Actually, this machine that it's just behind us and above your head, it's the last generation of repetitive transcranial magnetic stimulation with quite a wide range of different stimulative techniques.
I need to ask you this. No pain, very comfortable. So
no pain. No pain. You can just assume yourself as you are just sitting in your home in the armchair. So only the difference is that this kind of magnetic coil is just decreased and put just in a close contact with your head. And after that, you are receiving the trains of magnetic pulses, which is a bit loud. You can hear that, but it's not painful at all. So you are completely comfortable sitting in the chair, you can watching TV or whatever. We prefer not to sleep during the procedure, but everything else...
For the better performance.
For the better performance, and the other demand from our side is to be just in a same position all the time, not moving the head, because what we are doing actually, we are stimulating a very small and very focal surface of your head, so it's up to 2 square centimeters, which is quite precise for the purpose to get a better results.
Great. Apart from the patients that are suffering from depression, what kind of patients with neurological disorders are welcome to the clinic?
Besides the depression, I would accentuate as well the other psychiatric diagnosis, which is actually so-called OCD, or obsessive compulsive disorder, which we have a lot of experience and fortunately very good results. Besides that, kind of similar disorder is like Gilles de la Tourette syndrome, which is treated as well very successfully. In the field of neurological diagnosis and conditions, we prefer to apply technique for the people who have the consequences, sequelas of brain infarction or stroke. So there are different kind of consequences, like motor handicap, motor deficit, or weakness of the paralyzed arm or leg. That's the one kind of very typical problems with those patients, and the other one could be related to the problems with the fluent speech. So some people after stroke have a lot of troubles with the normal speech. So we are always using this technique like 30 to 40 minutes per session, and after that in close proximity we use the specific motor training, either specific voice therapy immediately after that. So it's a kind of a new hope for those persons.
Doctor, what is the procedure of doing this complete treatment, TMS? Can we also call other abroad patients to come and to welcome them in Belgrade and this clinic?
Yeah, it's possible. It's possible. Actually, we are usually using 20 to 35 procedures in a row. So it means every working day with a weekend pause. So that means that we have our patients for those treatment indication from 4 to 7 weeks on place. So they can spend, and I suggest that they spend the time in Belgrade, not to travel from another cities here or something like that, because it's very hard for patients, and actually the treatment should be applied under the best conditions when they have a good night rest and sleep, and they are in their best condition, generally speaking. So for anyone it's possible to do something like that, and it's done under the last international standards. I was doing for so long time, and just share my experience on very regular basis with colleagues abroad. And probably for some of people who can come from abroad, could be decision related to the cost of treatment, because considering economical standard in this country, it's substantially cheaper than in Western Europe.
You hear all this, so Dr. Tihomir Ilic and the clinic INOVIUM NEURO is the new hope if you find yourself related to this topic, so help yourself or your loved ones, and welcome to Belgrade. Thank you, doctor, so much, and good luck in your further work.
Thanks a lot.